So just give us a little bit of history about it. Yeah?
Sure. So Marks is the only World Centre of Excellence for Endoscopy in the UK. There are only 7 in the whole of the world, and we're the only one in England. And we basically pioneered endoscopy. So one of my previous mentors, Christopher Williams, is one of the first people in the country to do an endoscopy, and he was given this thing and said, see what you can do with it. So we've been doing this a very long time, and we like to think we're very good at it. We train an awful lot of doctors around the country and internationally. So again, we're one of a few national training units to teach people how to do endoscopies, because it's really important that it's done well. If it's done badly, it's pretty well worse than useless, because you can miss things. Yeah. So it's really important that when it's done properly, and that we find the things we're looking for.
And what sort of things are you looking for, particularly when it happens?
So it depends really on what people present with. So we can be looking for things like cancer, obviously, but we're also looking for a number of non-cancer diagnoses, inflammation, polyps, which can lead to cancer. We can look for other things like infections. There are a number of conditions that cause diarrhea or constipation that we can look for. Bleeding is quite a big one, so looking for things that can bleed. So there's a number of things. It depends very much on what people present with.
Now I can imagine a lot of people may be quite hesitant when they hear the words, because they kind of know in their head what's going to happen. I've had one, I know what happens. But it's nothing to be afraid of in many ways. It's a positive thing, because it's trying to look for stuff that's there.
And most people find it's really not as bad as they think. Certainly with a colonoscopy, I tell all my patients that if they can do the bowel preparation, so clearing the bowel out, that's worse than the test, and virtually everybody agrees afterwards. So if it's done well, it really shouldn't be a worrying or anxiety-provoking test.
And obviously you say it's perfected there, but obviously now this is the main way of looking for these sort of diseases, isn't it?
Yeah, this is the gold standard test. There are lots of other ways, so we have very good radiology, so CT scans now that can pick up things. But if you really want to make sure that there's nothing in either the stomach or the small bowel or the large bowel, endoscopy is your way forward.
Okay. Would people present themselves to their GP? Would the GP refer them to it, or is it something that goes straight to the hospital?
It depends really. So yes, GPs can request certain types of endoscopy. So endoscopy into the stomach and the gullet, many GPs will access directly. In the main for colonoscopy, so to look at the large bowel, actually usually they would be triaged by a gastroenterologist or a colorectal surgeon first, perhaps seen in clinic first, because that is a more difficult test. So it's more important to pick the right people.
Okay. And that's normally done as well. I think it was a nurse consultant that did it on me as well. So it's not always the doctors or anything else.
No, we have 5 nurse endoscopists now at St Mark's. We're training a 6th. So nurses play a vital role not just in help supporting the patient through the test. Actually, if they're trained properly, they do a fantastic job, and they get through massive amounts of endoscopies in our unit.
And I've been asking everyone today, why, for your own personal why did you think about this area of medicine when there's lots of other areas you could have gone into?
It's great fun. It's technically challenging.
Yeah.
So to do it well is really quite skilled, and so that provides a challenge for me in every day.
So it's the job satisfaction, really.
Yeah, job satisfaction. It's really important to what we do. So making those diagnoses is absolutely vital to then treating the patient properly. And it's actually one of those things that I enjoy as the best part of my week.
And I guess the thing that we're trying to get across today as well about the awareness, but it's the early diagnosis with any of this, really, isn't it? That it can be treatable and everything else.
I mean, that's the key to this. We don't do enough endoscopy in the UK. That's because of a number of different reasons. It's because we have probably not enough endoscopists compared to other countries. So we have increased that massively in the last 10 years or so, but we've still got a long way to go yet. And so to try and get people endoscoped early means that we will then pick up things early, and that has much better outcomes, and we know that's true. The logistics of that is difficult, but for an individual patient, any symptoms, see your doctor and they can refer.
And if someone wanted a career in this, obviously you'd advocate that. But
Absolutely.
So what's the kind of what's the route they would need to take?
So very briefly, it's medical school.
Yeah.
And it's then about 10 years of training after medical school, including specialising in the field of gastroenterology, be it either medical or surgical. And within that, you then get 5 years of very specific training in endoscopy as well. So it's a long road, 15 years in total.
But you can see where it gets in, what you can do for people and the job satisfaction and everything else. So I know you've got to get away, but thank you very much. Adam, please.
My pleasure.
Thank you very much. Right.